Awesome. Well, thank you everyone so much for joining us today. As you know, today we're discussing mental health and perimenopause in South Asian women, featuring our wonderful speaker, Dr. Harita Raja, who is a women's psychiatrist. And we can go to the next slide. So I'll just start off with a quick introduction about myself. Funny if I'm wearing the same blazer as in my headshot. I just realized that. I clearly have a favorite. But my name is Nisha Thurdeen, founder and CEO of South Asian Care. As a South Asian woman with a background in health communications and advocacy, I really saw firsthand gaps in culturally responsive care, which led me to create South Asian Care. Our mission is to address cultural barriers, connect our community to compassionate providers, and share trusted, culturally relevant health information. Beyond webinars like this, our website offers a provider directory, educational resources, and tools to support your health journey. Thanks so much for being here, and I hope you find today's discussion informative and helpful. We can go to the next slide, please. So next, I'd like to introduce our wonderful speaker who will be guiding today's webinar, Dr. Harita Raja. Dr. Harita Raja is a board-certified psychiatrist with a passion for women's mental health and wellness. She founded Bethesda Women's Mental Health to offer compassionate, expert care tailored to women's unique needs. She earned her medical degree from Albany Medical College and completed her psychiatry residency at Georgetown University Hospital, where she served as chief resident. Dr. Raja is a leading voice in her field with many accomplishments that you can see here on screen. During the pandemic, she launched the Ratrani Collective, a community initiative to uplift South Asian women and break mental health stigma through movement, connection, and education. Her mission is to support women's emotional well-being, celebrate their journeys, and build stronger, more connected communities. Thank you so much for being here today to partner with us on this important discussion.
Thank you for
We
having me.
can Yeah, we can go to the next slide, please. So with that, I'd like to pass it over to Dr. Raja to kick off this discussion portion of our webinar. If anyone has any questions throughout, please feel free to use the Q&A feature. We have reserved some time at the end to answer any of your questions. So thank you so much for being here today, Dr. Raja, and everyone for joining us. Really excited for this discussion.
Yes, thank you so much for having me and allowing me to talk about this topic that I'm so passionate about. And we're going to talk about perimenopause and mental health. And I think two real topics that have a lot of stigma associated with them for different reasons, and are, both often misunderstood, underdiagnosed. And so I hope I can, talk to you a little bit about them and help you get to understand them a little bit more. So just a few objectives we have today to really understand what perimenopause is and its impact on mental health. We also want to identify some common mental health symptoms during perimenopause. Often, we talk about other symptoms, which we'll also talk about, but we want to specifically address the common mental health symptoms. We're going to explore the cultural considerations of perimenopause and mental health, which is really important. And of course, we'll learn about some treatment approaches and support strategies. So let's just start with the why. Why do we care about perimenopause or menopause? Well, 100% of biologic women will experience this transition. This is not a maybe, this is a definitely. And 75 million women in this country are actually going through the menopausal transition. We'll talk about this in detail in a moment, but the menopausal transition is also known as perimenopause. 80% of women during this time in perimenopause and menopause will have symptoms. And the symptoms really can vary in how they present, but women are struggling during this time and often don't know why. 6,000 women will reach menopause every day. And I think most importantly, menopause used to be this time in a woman's life where we felt like it's the end of life, right? So women reach a certain age. In this country, the average age of menopause is 51 and a half, maybe a few years left, and then, a woman's life is done. Well, now, as women are living longer and living healthier lives, a third of a woman's life or more can be spent in menopause and postmenopause. And so we're talking about a significant part of a woman's life and one where she's still often very productive in her life. I want to focus on South Asians specifically, which we will do, and how they experience perimenopause and menopause differently is an important piece of this as well. So, what is perimenopause? So, I just want to start by defining the terms. So, when a woman goes through puberty and then starts getting her period, that is the time that we call premenopause. Not every woman will have regular periods, but many women will have regular periods during this time. And we call this the time prior to the transition. And so then there is perimenopause, which is the transition. And we're going to leave that as our middle point right now. And then we're going to define menopause. And menopause for a woman who's had her period is when a woman doesn't have a period for 12 months. So the only way to know if you've hit menopause is actually by looking backwards to say, oh, I haven't had my period in 12 months. So it's a retrospective diagnosis. So we look backwards and can get that. Menopause is a single moment, right? A single day where you hit menopause, which is 12 months of not having your period. And then anything after that is postmenopause. So let's go back to perimenopause. What exactly is that? Well, a woman starts getting changes to her period as hormones start changing. So, two important hormones in a woman's body are estrogen and progesterone. As those start changing, usually in the late 30s, early 40s, or mid 40s for some women, that's the time where we see that there's a transition in terms of the how often you're getting your period, maybe the flow of your period, how long the cycle lasts. And that time we also see a significant vulnerability for symptoms. It's only after menopause that you no longer ovulate and you can't have children. So in perimenopause, you actually can still get pregnant. So I know that's a little complicated, so I wanted to show this with a graph, and hopefully you can still see my cursor. Here, this orange line that's going up and down here is our estrogen. And you'll see up here, this is premenopause. And you'll see the teal line here that's going up and down, that's your progesterone. And every time you see this little pink box, you're getting your period. So you'll see there's a real cyclical nature to premenopause. Okay. We hit perimenopause. Like I said, it's, can be in your early to late 40s. And for some women, it's earlier. Now, we're talking about a woman who's going through a natural perimenopause. If a woman has had to, for example, have her uterus taken out and her ovaries taken out earlier than this, she may have what's called a surgical menopause. Happy to answer questions about it, but I won't get into too much of that right now. When we hit perimenopause, you'll see, look at these hormones, they're all over the place. It's like a roller coaster. And you'll see that you can have a regular period and then maybe sometime where you don't have a period and another period. And again, this can vary. When it's been a year of no periods, that's when you hit menopause. And then anything after that is going to be postmenopause, and the estrogen will still stay low. So you're not going to get this estrogen just come back up again. And progesterone will be low as well. So, as we said, perimenopause is a menopausal transition. On average, it actually occurs 4 to 7 years before menopause. So women for a long time thought, if I get these symptoms, it'll last a couple of months, I'll be fine. No, they can last for years. And for some women, they last even more than a decade. So this is a significant amount of a woman's life to be in perimenopause. And because of the unpredictable and intense hormonal changes, we see symptoms from head to toe. And I really like this list because it tells us how much our body can get affected and where, right? So we often think about hot flashes or night sweats. These are often referred to as vasomotor symptoms. You can see vaginal symptoms like vaginal dryness. You can also see pain with sex. You can see, of course, irregular periods. We see mental health symptoms, and we'll get into these a little bit more. Mood swings, fatigue, depression, anxiety, irritability, panic disorder. We can see joint pain. We can see disrupted sleep and muscle aches. There can be some ear itching. It's very interesting, but we do see that. We can see change of taste. We can see nails change. We can see memory changes. Okay, the list goes on. As you can see, from head to toe can be affected. And really not just the physical changes, but also mental and emotional changes as well. This is a vulnerable time for women. and their health overall. Let's take a moment now and really shift to the mental health piece of this. We consider perimenopause and menopause to be a window of vulnerability. And what do I mean by that? I mean that mental health can be impacted, and we can see an increase in mental illness during the time of perimenopause for many reasons. And so I want to go through these reasons because it helps us better understand this. So we can have physical changes, life changes, and hormonal changes that can really impact our mental health in perimenopause. So let's look at the physical changes. A lot of women can experience hot flashes. Majority of women experience hot flashes. This can be related to sleep changes or not, but there's often insomnia, as I'm sure many of you have heard during this time in midlife. There's also genitourinary symptoms. So these are the vaginal symptoms. And as we know, many other symptoms. These physical changes can impact mental health. Can you imagine you're not sleeping well? And every day you're waking up in the middle of the night, having trouble going back to sleep? That in itself can increase your anxiety and lower your mood, right? That also can impact your cognition. If we look at the other way, if we're anxious, that can impact our sleep. If we're anxious, we may notice that we have a higher tendency for our hot flashes to occur with the stress related to that. So really there's a bi-directional relationship. This is also a time in a woman's life where there are a lot of life changes. So for some women, they're in the sandwich generation. What do I mean by that? They're actually taking care of their parents and their children at the same time. And so they have this burden of caregiving, and that can be a real burden. We also see women during this time that can experience empty nest, which basically means their children are leaving home, whether to work outside the home or to go to college. And so there can be a sense of change and possible loneliness. For some women during midlife, we see their relationships change. There's actually an increase in divorces and separation during this time. And we also see career changes for different reasons. Excuse me. So it's really important. We've talked about physical changes and life changes that can affect mental health. And then I'm going to go to the hormonal changes. And there is absolutely a biological reason for the mental health changes we see during perimenopause, and the hormones play a significant role. We often think of these hormones, estrogen, progesterone, and testosterone, just to affect sort of reproductive health. But really, these hormones affect the brain, and it's important that we start connecting it that way. This is a busy slide, and I just wanted to break it down for you. So the key menopausal hormones, again, estrogen, progesterone, and testosterone, and they're going to be made in our bodies. And you see that, the estrogen is produced by follicles in the ovaries, the progesterone is released after ovulation, and testosterone is also made in the ovaries and the adrenal glands. Often there's this relationship, that an association of testosterone with being only in men. That's not true. Women actually have significant testosterone in their bodies as well. So remember, during this perimenopausal period, we're going to have changes in estrogen and progesterone that are going to be quite erratic. And we're going to see testosterone, which is like this blue color, sort of gradually decline. It'll continue to decline slowly while the estrogen and progesterone sort of tank out in postmenopause. So why are these hormones important, especially in the brain? So I'm a little bit of a science nerd, so I'm going to do that for a moment, but I think it's interesting, right? We have estrogen receptors in the brain. So I consider estrogen also a brain hormone. And interestingly, our brain has these receptors in many locations. And so estrogen starts to impact and affect what we call neurotransmitters. These are the chemicals that are communicating in our brain that can affect mood. And those neurotransmitters are like serotonin or dopamine. Estrogen is also protective of our brain and contributes to something called brain plasticity. So let me explain what that means a little bit. So brain plasticity is when the environment of the brain changes, and estrogen helps our brain to adapt to those changes. Progesterone also influences brain function. It works on something called the GABA receptor and can have a calming and anti-anxiety effect. And then testosterone, we're getting more and more data about, but also seems to impact energy and anxiety and depression, or some of their symptoms. And so it's something to watch as we move forward. So, for the reasons that we discussed, the physical changes, the life changes, and the hormonal changes, we do see an increase of mental health symptoms and sometimes mental illness, right? So, it can be symptoms or an actual diagnosis that increase during perimenopause. That's the most vulnerable time. 82% of women will experience anxiety, depression, and or panic attacks during perimenopause. Women have never experienced this before. It can feel quite scary and feel like something's really wrong with them. And so normalizing that this can happen, and not that you have to live with it and suffer with it, but this understanding of how hormones and other changes can impact mental health during perimenopause is vital. So let's talk about some common mental health symptoms. I think one really important point to note is before we even see physical symptoms, sometimes the psychiatric symptoms can come up. And so if a woman is in her early to mid 40s and she comes to see me and she's like, I don't understand. I've never had symptoms before, and I am now having panic attacks all the time. There's no trigger. My period's been a little bit different, maybe. She's probably in perimenopause and experiencing these symptoms. So again, I want to make the clarification. Some women have symptoms and some women have full-on disorders. So if we look at depression, for example, there's something called the DSM-5, which is what psychiatrists use to actually diagnose patients with certain disorders like major depressive disorder. Well, to have that, you require an actual constellation of symptoms. So it's mood changes, changes to sleep, changes to appetite, your concentration changes, your energy changes. So there's a lot of things that are involved. For some women in perimenopause, it might just be that they have mood changes or just irritability. So those would be the symptoms. So we do see an increase in depression or depressive symptoms. We have a lot less research in bipolar disorder. And there does seem to be this peak in bipolar disorder that happens, a secondary peak during midlife, but we do actually need a lot more research to understand this. In terms of anxiety, there are different types of anxiety. So, generalized anxiety is when a woman is having symptoms for months and experiences worrying and restlessness, and she really is struggling with the anxiety in an overwhelmed sort of way. Again, she can have symptoms or actually fulfill this diagnostic criteria for the disorder. Women who come with panic attacks may have panic disorder, and phobias are specific fears to something. So you'll see, you can have anxiety and depression during perimenopause. Two other really important considerations during perimenopause from the mental health perspective are cognitive changes and ADHD. So let me say a word about both of them. About 60% of women will experience cognitive changes. And this can be really scary, especially for women who have a history of early dementia in their family or have known someone with early dementia. But it's important to get evaluated and to understand that when estrogen lowers and fluctuates, that there can be a change to the cognitive status. What does that mean? Well, some women start to have word finding difficulties. They might be talking to their child and saying, that thing that, and they really can't capture the word in that moment. Or they may have difficulty sort of absorbing information. So if someone's talking to them, they may not understand the same way they did. A lot of women describe something known as brain fog. It is just their brain feeling much slower and having less capacity. For women who have this symptom in or these changes in perimenopause, it is not necessarily a permanent change. Many women will bounce back to their original state postmenopausally. Why is that? The brain is adjusting. It is actually having more estrogen receptors in the brain to adapt to the changes that are occurring. Some women will sort of stay where they are in terms of their symptoms having gotten a little bit more, and then other women will continue to get worse. And so, looking at the path of how these symptoms present will be really important. ADHD, or adult deficit hyperactivity disorder, so it can be more inattention or hyperactivity. We can see a new onset of this in perimenopause. And we can also see that it might overlap with some of the cognitive changes or brain fog. And so it can be a real art to distinguish it. But I think what's important here are there are changes to the brain. And if you're feeling different, to really listen to your body and to understand that it's real and it's not just in your head. So, am I at risk? That's often a question that's asked. Am I at risk to have mental health symptoms in perimenopause? Well, if you've had a history of any mood disorder, but specifically around your period, or maybe during pregnancy or postpartum, you may be at an increased risk. If you have a longer perimenopausal period, so if you're having more physical changes during this perimenopausal period, understandably, you may be at an increased risk. Physical symptoms themselves can be contributing to mental health symptoms. So, for example, if you're having hot flashes and they're untreated for a long time, and this is why we treat them, they can lead to insomnia, which could lead to increase in anxiety, which could lead to depression. So, you can see there's this real domino theory and domino effect. A family history of perimenopausal depression or depression and during this time it can put you at an increased risk. And race matters. So actually, as South Asians, we're a little more protected. Black women and Hispanic women are at an increased risk of longer perimenopausal periods as well as more intense symptoms. So let's talk about the cultural considerations. Why is it that we don't talk about perimenopause or seek the help we need, specifically around the mental health symptoms? And we know that culture plays an impact, not just for us as South Asians, but also in every ethnicity. And it impacts how we address the symptoms, how we experience the symptoms, and how we seek out support. So many of us South Asians feel like we are straddling two worlds, right? We may be American in India, for example, and Indian in America, and trying to sort of find our place matters. There's also this increase in domestic violence that is often unspoken. Trauma plays a significant role in perimenopause. Now, we actually don't really know the numbers about domestic violence in midlife in South Asians, and different studies will show us different numbers, but it's quite significant. And the reason that's important is that trauma itself can impact how we experience perimenopausal symptoms, and they often are more severe symptoms of depression and anxiety if you have a history of trauma. Now, 90% of women will have trauma in their lives. Now, we're not always talking about big T trauma like sexual abuse or an assault, but it could be that you had a really unstable household, and that's what we call like a little T trauma. The idea is any sort of trauma can impact how you experience these symptoms. Unfortunately, for a lot of South Asians, struggling has been normalized, right? Martyrdom is worshipped. And so women have seen their mothers and their family members just struggle through, and they are taught to white knuckle it, unfortunately struggle, but it comes at a cost. It comes at a cost not only for themselves, increasing their risk for chronic medical illnesses as well, but also who's around them, right? It impacts their relationships, impacts their children if they have children. And so there's really a downstream effect for this. Let's talk about the model minority myth. There are certain cultural expectations for different ethnicities. With South Asians, there is this idea that every individual will be smart, they'll be wealthy, they'll be hardworking and self-reliant. And unfortunately, some of us take on that burden of this model minority myth. And when we do that, we feel that we have to take care of ourselves and, again, get through anything and show that we are doing well and we're perfect. And in trying to do that, we don't reach out for help because we don't want it to look like something's wrong. And when you do that around mental health, um, we wait until we hit rock bottom, and that can really impact us in a negative way. So, the expectation for us might be, and I just love this because I think it so beautifully shows this in a graph, right? We're born, we're well behaved, we go to school, we have a good career, we have kids, we get married first, and then we have kids, and then we never have any issues ever, and we take care of our parents, and that's our life. And as you and I all know, that life isn't like that. And when we show up as we are, we actually take care of ourselves better, and that allows us to tolerate the changes that occur in perimenopause as well. So our societal norms are different, right? In South Asia, it's a collectivist society, and that translates even when we're here in this country. I think especially children of immigrants. And there's really this group mentality. So there is not the idea of independence, but rather that we rely on each other. And sometimes there's this real hierarchical model, right? It's not all bad. There is some real comfort in it. But unfortunately, it can lead to certain expectations that can lead to misunderstandings and um, misattribution of fault. So if we look at mental illness specifically, in this hierarchical model and this collectivist model, parents are often seen to be at fault when children have mental illness. And that can lead to a lot of guilt, shame, and blame. And so, if there is any mental illness, it's really hush hush and we don't talk about it. And unfortunately, that can also lead to a lot of suffering. Interestingly, we are missing a lot of emotional language as well. And so sometimes women experience mental illness and don't really have the words to describe it. Because they don't have the words, they feel like maybe it's in my head, maybe these symptoms are not really valid. And it's not surprising because of that, that South Asian women often show up in primary care doctor's offices or maybe a GI doctor or a OBGYN's office with physical symptoms that are actually manifestations of their mental health declining. So let me give you an example. A woman may be experiencing significant stomach pain, and when the workup is done, there are really no reasons for that stomach pain except that she has significant stress. And when you treat her for that, we'll talk about that in a moment, her stomach pain actually lifts. And that's how we know that that was related. Seeking mental health support has significant barriers within our society. The idea is, why the heck would you talk to a stranger when you have family, right? Therapy feels like a breach of family loyalty and is considered a Western concept. And so, for a lot of people, I think this is changing, thankfully. It feels like you're doing something wrong by reaching out for therapy. So remember, honor is everything, reputation is everything. And so what does this translate to? It translates to South Asian women are 3 times less likely. Let me say it again. 3 times less likely to utilize mental health services. And that is purely because of the reasons that we've discussed. And it absolutely leads to a burden that is, you know, persistent and from generation to generation. And this has how we created intergenerational trauma. So let me now just change, topics to treatment, because I think it's really important to understand that, yeah, there are barriers to why we don't seek out treatment, but is there even treatment available? Yes, yes, and yes. So there are many different treatments available, and I'm just going to go straight into medications, hormonal treatments, and therapy first, but then I'm going to go to other treatments that are available. So if we look at why are you having the symptoms in perimenopause? We need to look at the root cause. Your symptoms may be a result of the hormones changing specifically in perimenopause, and that's what's causing your symptoms. So, like again, the woman who comes in for the first time ever having symptoms is likely having symptoms because she's in perimenopause and it's the hormone changes, and probably the hormonal piece needs to be addressed first. But there are many women who have a long psychiatric history and actually need to be on medication during midlife, and it's not necessarily related to their hormones. And then, of course, there are women who have both. Now, if you have any symptoms during midlife, does it mean you have to be on medications? No, absolutely not. I think it really depends on how intense your symptoms are. What are the other things we can do? Psychotherapy or talk therapy can be really effective. I do not want you to go talk about what you had for dinner and what you did yesterday. So it has to be really evidence-based therapy, meaning that you are talking through your feelings and your emotions and working through these possible traumas and processing it so that you can actually change the connections in your brain, which allow you to be doing better mental health wise. And so therapy can be really effective and with mild to moderate symptoms, sometimes even as effective as medication. Now, I should have done this slide first, so forgive me for that. But let's just talk about lifestyle modifications because that is so key in all of this, right? I can throw medications at patients, I can throw, therapy at patients, and they can be really important and necessary for some women. But what can we do day to day? Well, we can focus on the basics. And the basics include nutrition, physical activity, sleep quality, and social and emotional support. So I know this is going to sound basic, but I'm still going to talk about it because I want you to hear it again, right? Balanced meals with fruits and vegetables and protein and actually healthy fats too are so important for brain health. The Mediterranean diet is associated with lower rates of depression and anxiety. Do you have to follow just the Mediterranean diet? No. I think there's a way to incorporate, South Asian diets. We just have to be really thoughtful on what would be helpful for us in terms of our nutrition. It's also important not to starve ourselves, right? Blood sugar impacts our mental health. So if your blood sugar is going up and down rapidly, or we are, eating only intermittently, and I'm not talking about intermittent fasting, I'm talking about like you eat one meal a day and that's it. Our bodies are not going to respond well to that. And if our blood sugar tanks and we're sensitive to that, you may have symptoms just because of that. Let's talk about physical activity. Regular exercise, we know, improves mood. It reduces anxiety and it actually improves cognitive functioning. So, is it only for, losing weight or, running a marathon? No, it actually improves mental health. And so, do we have to walk an hour a day? No, start at 5 minutes. It's all relative to what you're doing now. And if you make this a regular part of your routine, it's very easy to see the impact it has. Sleep is really important. Consistent, high quality sleep is essential for emotional regulation. What does that mean? It means how do you manage your emotions when things are challenging? It also impacts our memory and how well we can respond to distress. And finally, having a trusted community is really important. It provides a space for us to not only learn, but to be heard. And there's data to show this. This isn't just us like, talking and out of left field. There's data to show when we have community and when we have connection, we actually live longer and live healthier lives. So I just wanted to say a couple of words about this organization that I founded in 2023. It's called the Ratnani Collective. And my thought was, how do we talk about mental health in our community? And it's hard for us, right? The way a lot of us grew up and how we were raised, it's something that is considered a taboo topic. Again, this is changing and it's amazing to see, younger generations really embracing the conversation. But I wanted to make this something that women could do in midlife, even though they may not have done this before. And what we did is we actually started Zumba classes that we incorporated conversation in, and that has now expanded into, strength training, yoga, book clubs, other sort of interactions and group activities. And it's really created a community that has allowed women to pursue better health and well-being together. It's allowed them to feel more empowered, and the deeper social relationships have been really important for the community to grow. So, again, thank you so much for being here. It's so important for us to educate ourselves on topics that impact us. And whether you're a woman or you're not, you will know women who go through this stage in their lives, and a lot of them will struggle. And I actually have a couple of books I just wanted to share with you, and I have no commission or anything from them. But there are two books. One is called The Menopause Brain, and it's by a researcher from New York City, Lisa Mosconi, and she really looks at the brains of women and specifically during midlife and how it impacts them. So I really like this book about the menopause brain. And then there's another book called How to Menopause, and again, gives us the basics of understanding this time in our life, and that's by Tamsin Fadal. And there are other books out there, but continue to educate yourself in this area. Um, my, ways to connect with me are here. Here's my Instagram, my LinkedIn, and also my email address. So if you have questions, please let me know if I can help you. And I am going to say thank you and open up for questions.
Thank you so much. Before we get started on the Q&A, I just want to say thank you for that extremely informative and important discussion. I
Of
know
course.
I learned so much and I just appreciate all the hard work you do, and I know our community does too.
Thank you.
We have a few questions in the Q&A, so I will read them off to you. So our first one is, hi, I'm 43 and on oral birth control plus Lexapro for about 4 weeks for anxiety and depression related to perimenopause. The anxiety is a bit better, however, I am not sleeping and also have a loss of appetite. Should I consider BHRT for myself?
This is a great question. And I want to just first off say that I don't want you to take this as medical advice. I obviously don't know this woman, but I appreciate you asking the question. So let me talk about in general. Um, a lot of women are put on oral birth control during perimenopause to help with their symptoms. Now, oral birth control is synthetic hormones, which means that it's not just like the hormones we have in our body, versus hormone replacement therapy, which is estrogen, estradiol, and progesterone. They're bioidentical, meaning that they're the hormones like we have in our body. And so they're not the same thing in terms of how your body responds to them. And if we're looking for the impact on anxiety and depression, the hormone replacement therapy can be very effective if there's no reason that you shouldn't be on it. So that is absolutely an option. I have to take a step back and say, and from my understanding, the Lexapro was only started 4 weeks ago. It can take 4 to 6 weeks to really reach its full potential, and the dosing matters as well. So I think there's a number of things that can be played around with here. And for sleep, there are also things that we can do specifically. So I know I'm being a little vague. It's hard to know without without knowing you completely. But I think the points I want to make are psychiatric medications can take some time to work. If this is in perimenopause, hormone replacement therapy is an option, and um, and sleep can be treated as well. And I'm glad you're thinking along these lines. I would also ask the question, in terms of the sleep, what's the reason you're not sleeping? So if you're having hot flashes, then I would 100% recommend the hormone replacement therapy to help with the hot flashes, which could then help you sleep better. If you're sort of reeling at night and you're ruminating a lot, that could be because of anxiety. And that might be that the Lexapro needs to be at a higher dose, or we need to give it more time. So I think there's a lot of things to think about for this woman.
Thank you. Okay, our next question. How can partners or family support someone going through this transition?
It's a great question. I just love this question because it is just like in pregnancy and postpartum. I see perimenopause and menopause as a family issue because it absolutely impacts everyone in the family. And I think first and foremost, we need to normalize the conversation. So I have two kids at home. I have one younger child who's a boy, and we talk about periods and we talk about perimenopause and menopause like it's like having high blood pressure or diabetes. And so, first of all, let's just start normalizing the conversation. Second of all, I think we need to educate specifically on these topics. And so there is a great clinician by the name of Mary Claire Haver. And if you look up, she has, I think it's on her Substack, where it's like a man's guide or a partner's guide to perimenopause slash menopause. So there are different resources out there really aimed at partners and people who are not going through it for families. And I think that that is the first step. And then communication, right? Within partners, like let's talk about what the woman in your life specifically is experiencing because everyone's experience during this time is different. So one woman may have really severe symptoms and another woman may not have such severe symptoms. One woman may have really bad hot flashes while another one really has like significant pain with sex, right? So I think it just varies. And so communicating to really know the individual symptoms can be really important as well.
Great. And another question on a similar note, but someone asked, many women, especially South Asians, don't seek help due to stigma. Do you have any advice for someone who feels shame speaking about menopause or mental health?
Yeah. I, It hurts me to hear this because I've seen it my whole life, and I think a lot of us have. And I think it's first important, and I have one right here, so I'm going to show you. It's important to have a journal, okay? Start writing about why the stigma. And I think it's probably from how you grew up. So it's important to surround ourselves with people we feel comfortable with to start these conversations and to normalize, but also finding trusted providers. And I'm not saying I recommend this is the only route to go, but if you're really uncomfortable, like going in person, find a telehealth, perimenopause, menopause service. Like just start having a conversation so you know what your options are. Um, Talk to a therapist first if you don't want to talk to a psychiatrist, right? Like I know there are different levels of stigma, but what I can tell you is when you find trusted providers, you have the potential to live a better quality of life. And that is what I often tell women. Like, even if, and I'm a women's psychiatrist, so I do prescribe medication, but even if you're uncomfortable with the idea of medication, but you're really struggling, come see me. Let's have a conversation, right? And I'll tell you what I think. And sometimes I'll say, look, I don't think you're a candidate for medication because I think you would do better with X, Y, and Z. But if I say to you, like, look, I highly recommend you need to be on medication for these reasons, fine, take that education and then decide what you want to do. So I think if I break this down for you and I have to simplify it, I would just say, like, give yourself the opportunity to be educated and then make educated decisions as opposed to decisions based in just the community conversation that may not be based in science.
Next question. If my mom has bad symptoms of menopause, does that mean I will?
No, it does not mean you will. There are things that we can do even since our 30s. I didn't even talk about bone health, which I should in our population, right? Eh, The reason I say that is like, for example, my mom has osteoporosis. I'm not bound to get it just because she has it, even though genetically we have similar material in our body. Because if I start strength training and she never did it, I'm putting myself at a different risk stratification. What's the point? The point is that there are so many things we can do, and it's not just based on genetics. So we always talk about nature versus nurture, right? Like, is it the environment? Is it what we're doing versus what we have in our body in terms of genetics? Genetics is one part of the picture. Yes, it may put you at a higher risk, but if your mom had significant symptoms, find out what they were. Find out how she experienced it. What was her treatment like? What were her supports like? And then we come up with a plan for you now, right? What is the plan that you want now to create the best possible outcomes because there are things we can do to make this experience better. And it's not just a, it is what it is sort of conversation.
Wonderful. Thank you so much for those insights. I think those are all the questions we had in our Q&A box, but anything else, Harita, you'd like to add?
No, I'm just really excited we're having this conversation, and I hope we continue to have conversations about this time in women's lives because it's going to happen to all of us who are biologically female, and it's better for us to be ready for it than to, fall into it and then really struggle. So we have control over our health, so I hope we, continue to feel empowered to make changes related to that.
Absolutely. Actually, we had one more question come through,
Sure.
so since we have some time, I will read that out. Okay. For those of us with moms who are in their later 70s living here in North America, we are noticing some having noticeable struggles with memory, anxiety, and depression. Often it appears such symptoms can be triggered by loss of a spouse, be it a positive or negative marital relationship. Are you seeing such cases more among young elderly women as they are a generation who had to straddle patriarchy, caregiving, immigration in their 20s, stigma, etc.? There appears to be resentment, anger, and grief, which arises after being such powerhouses at their peak for their families. For me, I have noticed that validating that person's feelings and experiences is a great place to start. As a physical therapist and somatic yoga teacher, movement and breathwork are transformational on the spot.
You nailed it. I don't even know if I need to answer the question. You nailed it. Like, thank you for writing that. It is absolutely something I see all the time. And again, you got really deep there, right? It doesn't matter if it was a positive or negative relationship, a loss is a loss. And I think there's a loss of the individual identity, there's a loss of relationships, there's a loss of a person in your life. And so all of these dynamics play a role. And being in this country is a loss of identity for a lot of immigrants as well. And so, I didn't talk about yoga and breath work and movement as much as I could have talked hours just about that. And so there are so many treatments that can be helpful like that as well. And if I'm just going to put my contact information for any of you who want to talk further, please email me. Let's keep this conversation going. But I think there is so much potential here in how we take care of our community.
Thank you. And thank you to all our attendees who have participated in the Q&A. I know these are really important discussions, and thank you, Dr. Raja, for continuing this conversation. I do find some of these discussions are hard to come about, especially when we're talking about things that are stigmatized or taboo in the community. And, what I think really starts the conversations is having things like this, open dialogue, asking raw questions, and just discussing it amongst our community. So I
Yeah.
really appreciate all of your hard work and your impact and, helping everyone. And I know you make such a big impact and a difference in everyone's lives. So I really appreciate your partnership. You make our mission possible at South Asian
Of
Care.
course. Thank you so much. Thank you.
Absolutely. And for everyone, please feel free to reach out to Dr. Raja here. You have her information, and we will continue all these conversations. And we have other upcoming events, so please feel free to visit our website and stay tuned for further discussions on these important topics. Thank you, everyone, for joining today, and thank you again, Dr. Raja, for your partnership. Bye.
Bye.